The biggest problem that I see when I look at this program is the lack of oversight, the lack of accountability, the lack of transparency.
Through a little-known federal funding stream, cities and counties that own nursing homes that accept Medicaid patients can get additional tax dollars meant to improve care for elderly and disabled residents. Over the last decade, state records show these facilities have received $1 billion in your federal taxpayer funds under the program.
With that much money, you would expect that you would see outcomes.
But an analysis by a local law firm shows that since 2017, the quality of care at these facilities has actually been worse than at facilities that aren't receiving all that extra money.
There are real people in here who are suffering.
Why should the federal government pay you more money to not provide high quality care?
I'm investigative reporter Taylor Stevens, and I've been looking into how this program works. I'll explain what the data shows and the pushback we're hearing from Utah's nursing home industry and the Department of Health and Human Services about allegations of poor quality care.
I got gastroparesis, where your stomach kind of dies from not being used for 7 months, and it just led to chronic issues.
Donnie Hunt-Webb is a 55-year-old former social worker and resident at St. George Rehabilitation. She says she sought long-term care due to severe health issues.
The minute I conceived her, I could not keep any food or liquid down.
The nursing home where she now lives is owned by Beaver Valley Hospital, which itself is owned by the city of Beaver in central Utah. This hospital is the biggest participant in Utah's upper payment limit program. With more than 40 facilities, more people now live in nursing homes owned by Beaver Valley than actually live in the city of Beaver. Beaver Valley's nursing homes have received more than $800 million in federal funds, meant to improve care for patients like Hunt-Webb.
It's CNAs, it's extra staff that we don't get.
State records show St. George Rehabilitation has received $20.9 million through the upper payment limit program since 2017. But the facility still has a below average staffing rating for the Centers for Medicare and Medicaid Services, or CMS. Though data shows its overall staffing has improved slightly since 2017, as has its health inspection rating. But Hunt-Webb, who's lived at St. George Rehabilitation for about 7 years, feels the extra dollars received through the upper payment limit program haven't done enough to improve her care at the facility, and is frustrated after reading a 2017 legislative audit that previously raised concerns about Beaver Valley's administration of the program. It found less than half of the money was making it to nursing homes, with the rest going to administrative costs and program match funding. There are no specific requirements dictating how much of the money must go to direct care.
There's not that many people in Beaver. I don't understand why they're allowed to take the money from nursing homes.
I reached out to St. George Rehabilitation, but they declined an on-camera interview. An administrator told me in an email that they prefer to personally connect with our residents rather than involving the media. The government entities like Beaver Valley Hospital that are part of the upper payment limit program own the licenses for the nursing homes and take a cut of the federal funds. But that doesn't mean they're overseeing day-to-day operations there. Instead, the facilities are largely run by private management companies.
They work in concert with the private corporations because it has to be government-owned in order to draw down on these supplemental Medicaid dollars.
St. George Rehabilitation, where Hunt-Webb lives, for example, is operated by the Ensign Group, a private equity chain with about 300 facilities across the country. As for Beaver Valley,
and they're really only owners in name, right? They're not operating the facilities, they're not there.
All they own is the license, and yet almost half of what the state pays in UPL dollars for my care goes to Beaver.
Hunt-Webb isn't the only one wondering how this money's been spent, as several analyses raise questions about the quality of care at Utah nursing facilities that are receiving these extra federal dollars.
In almost every case, on average, they significantly underperform against the non-UPL facilities.
Barry Toon is an attorney working with the Elder Care Injury Group. The practice group is currently pursuing several ongoing cases filed by individual families against facilities that are owned by Beaver Valley or Gunnison Valley. That's another major participant in the upper payment limit program. An analysis of publicly available federal data the group commissioned found that since 2017, upper payment limit facilities have had worse overall ratings, higher deficiency scores and inspections, and lower staffing ratings, which are based on staffing levels and turnover. While still behind non-upper payment limit facilities, data does show quality ratings and inspection scores have improved slightly in nursing homes part of the program since 2017, while staffing metrics have declined since that time.
When you look at really every available metric to determine are these facilities doing better with the money that they've been given, they're not. They're just not.
I've reviewed hundreds of pages of court filings and found that upper payment limit facilities are facing nearly 20 ongoing lawsuits. In many cases, the complaints were filed by family members who allege that poor quality care led to the death of their loved ones.
So a lot of these upper payment ones are not the ones getting the highest reviews, and we're seeing a lot of problems in them.
Nate Krippus is a staff attorney at the Disability Law Center of Utah, which is concerned about conditions at upper payment limit facilities. I think the question is, if that money isn't improving care, where is it going?
I think that is the question.
I reached out to the Utah Department of Health and Human Services and the Utah Healthcare Association, which represents the state's nursing homes. Both pushed back on those analyses, as did Gunnison and Beaver Valley. They declined on-camera interviews, but argued in written statements that it isn't fair to compare Utah's upper payment limit facilities with facilities that don't accept Medicaid patients. That's because they say of the more complex health needs of Medicaid patients. However, the upper payment limit program ensures both types of facilities receive the same amount of funding. DHHS says the most recently released quarter of data shows Utah's upper payment limit facilities have similar overall scores as national ones, including non-Medicaid facilities, and have substantially higher quality scores. Beaver Valley told us the challenges reflected in federal data are indicative of national pressures on nursing homes. When issues are identified at Beaver facilities, they said they're addressed and steps are taken to improve care. They added that upper payment limit is a long game, with the goal of sustained improvements that continue to strengthen the quality of elder care in Utah over time. The city-owned hospital also said lawsuits pending against Beaver Valley facilities represent a small fraction of the thousands of seniors who receive care each year. And they accused malpractice attorneys of misrepresenting the complexity of this program for their own self-interest.
So it brings federal resources to Utah nursing homes.
At a board meeting earlier this summer, Gunnison Valley Hospital administrators read from a document addressing criticisms of the program.
Once critics have understood the goals, process, logistics, and the actual improvement of healthcare provided to Utah's elderly, all at no cost to the state of Utah, they typically and rightly become supportive of the program.
We became involved in the establishment of the UPL program in the state of Utah.
In a Beaver Valley produced video, Utah operators also praised the upper payment limit, saying funds have improved patient quality of life.
Financially, it has been a true blessing to the state of Utah and to those we serve.
Those who remain concerned say they believe the upper payment limit could be a positive for Utah's nursing homes.
The intent behind the UPL program was very good. The idea of providing better reimbursement rates, higher reimbursement rates for Medicaid residents so that you can improve the quality of care is a noble goal.
They just want to ensure the money actually improves patient care.
If anybody needs help and anybody deserves more dollars that go to direct care to take care of those people, it's our elderly population.
We need someone watching. There needs to be accountability of where the money is going.
Tomorrow on Fox 13 News, our Care in Crisis series continues as we explore critiques of spending under the program some say has improved facilities, but not patient care. Taylor Stevens, Fox 13 News, Utah.
If you ask most residents, they'd rather have enough staff to feed them. to get them dressed.
I'm investigative reporter Taylor Stevens. Last night, we reported on concerns surrounding poor care in Utah's government-owned nursing facilities, which have received $1 billion in extra federal taxpayer funds over the last decade.
There's a lot of money flowing in.
Now, the debate over where some of the money has gone and what those who are concerned about the program would like to see happen next.
If people aren't aware of it, nothing will ever change.
Here in the rural Utah community of Beaver, construction crews are hard at work on a brand new Beaver Valley Hospital Wellness Center, with plans for a recreation pool and lazy river, a multi-purpose gym, and exercise studios. Next door, the city-owned hospital recently received its own renovation, complete with improved operating rooms, a dedicated helicopter pad, and specialty clinics. In 2021, the city of around 3,500 people estimated the project would cost $30 million.
We're in the middle of a remodel of our own hospital so that we can provide better quality health care and state-of-the-art health care to rural residents, and that doesn't happen very often.
Beaver Valley CEO Scott Langford spoke about the hospital remodel in the video you just saw. He declined an on-camera interview with us, but Beaver Valley told us both the hospital upgrades and the wellness center were paid with a portion of funds received through the state's upper payment limit program. That program allows non-state government entities like cities and counties that own nursing homes that accept Medicaid patients to receive extra federal funds for the purpose of improving care at those facilities. Under the program, Beaver Valley owns the licenses for more than 40 facilities. The hospital says it's been saving its portion of the proceeds for 13 years and is now reinvesting them for the benefit of Beaver residents.
The money that comes into these facilities is meant for care.
Sam Brooks leads public policy at the National Consumer Voice for Quality Long-Term Care, which advocates for better nursing home conditions. He says this program is meant to improve care for seniors at Utah nursing homes and argues a hospital remodel isn't the best use of those funds. He believes
They should not be using these facilities to fund other types of endeavors like healthcare centers or workout centers or things like that.
over the last decade, about $1 billion have gone to Utah nursing homes that are part of the upper payment limit program. But an analysis of federal data commissioned by a local law firm shows that compared to nursing homes that aren't receiving all of those extra funds, upper payment limit facilities have worse overall ratings by the Centers for Medicare and Medicaid Services. They also have higher inspection deficiencies and lower staffing ratings, which are based on staffing levels and turnover.
That money was supposed to provide for more staffing.
Beaver Valley, the nursing home industry, and the Department of Health and Human Services have pushed back on that analysis, arguing it isn't fair to compare Utah's upper payment limit facilities to nursing homes that don't accept Medicaid, given the more complex health needs of patients. But advocates and residents like Donnie Hunt Webb, who lives at a Beaver Valley-owned nursing home in St. George, say spending needs a closer look.
I have a lot of anger. Why do they deserve it when I'm watching my roommates and my neighbors right here suffer and me suffer?
Beaver Valley says only a small portion of upper payment limit funds are used at its hospital to improve access to care and health services. In addition to its hospital remodel and new wellness center, it says program dollars have also been used to improve the physical facilities at the nursing homes it owns.
We've been able to replace 4 buildings with brand new infrastructure and are in the process of working on a 5th.
In this video produced with Beaver Valley, some of the private management companies that operate the facilities it owns also tout the benefits of the upper payment limit program.
Without the program, services that are provided now would be limited. Facilities would not be able to have the resources to continue to do remodels, refurbs, and build new facilities like this.
Beaver Valley says it's allowed under the program to improve or build healthcare facilities, since those upgrades improve patient care. But it says most program funds have been used for more direct patient expenses.
Sure, we have an outdated nursing home system, but the priority for this money should be resident care.
But Brooks remains skeptical of the value of these capital improvements, arguing that they ultimately benefit facility owners more than residents.
If you saw capital investment resulting in better health outcomes, That's one thing.
As questions about how this money is being spent grow, skeptical observers say they want more funding oversight.
The numbers that we have are big picture numbers, and we need more detail. That's why we need more transparency.
Jeffrey Eisenberg is an attorney with a local law firm that is currently pursuing multiple cases against upper payment limit facilities, including ones owned by Beaver Valley. One of their goals is to better account for these facilities' spending.
You're taking in the government's money. Show the government, show the taxpayer your books.
In a statement, Beaver Valley told me regular audits are required of the program, and it receives strict oversight at both state and federal levels, making misusing funds virtually impossible. But critical observers aren't convinced.
We've tried to talk with legislators about a legislative audit to look into this, or even a state audit. Where is this money going? Because if patient care is worse in places that are getting higher rates, that money is going somewhere.
Nate Krippis with Utah's Disability Law Center is also concerned about how this money has been spent, and has joined attorneys like Eisenberg with the Elder Care Injury Group in calling for a new audit of the program. After spending close to $1 billion, they say Utah families deserve to understand where the money is going and why it doesn't seem to have improved care for the people they love the most.
This is a subject that demands some more scrutiny, because we are now talking about going on close to $1 billion, and we don't see the metrics to show that it has resulted in better care.
We reached out to both the Legislative Audit Committee and the State Auditor's Office to ask whether they have any plans to take a closer look at this program. Both said they do not comment on audits until they are complete, and wouldn't say whether they are looking at or may look at the upper payment limit. The Department of Health and Human Services told me it holds facilities accountable to quality metrics, including through its Quality Improvement Program. But it said it does not track specific spending related to how the UPL monies are being used. Taylor Stevens, Fox 13 News, Utah.
So this is a very, very serious issue.
Older adults with cognitive deficits are wandering away from Utah care facilities, sometimes disappearing for hours before anyone realizes they're gone. And in some cases, the consequences have been devastating.
They may be freezing to death in a snowbank or suffer a heat stroke.
Too many families have lost loved ones with dementia to wandering.
I'm Fox 13 investigative reporter Taylor Stevens. As our Care in Crisis series continues, I've been trying to understand how often people are wandering away from Utah's nursing homes and assisted living facilities, and what can be done to prevent it.
How long has he been gone?
We have some of them that'll smoke, so the staff could have
let him out.
This body camera footage from the South Ogden Police Department
And then nobody babysits them while they're out?
shows the initial search for James Buchanan, a patient at South Ogden Post-Acute, after he slipped out of the nursing home's secured memory unit in late September 2023 without staff noticing. As they check the facility's grounds, a staff member explains Buchanan's cognitive deficits.
He couldn't tell you what day it was, couldn't tell you what city he was in.
Buchanan was diagnosed with vascular dementia in 2022. After he started wandering away from home, his family moved him to South Ogden Post-Acute for more supervision. But police records show he left twice early in his stay, once making it to the next county over on foot before officers picked him up. Now, more than a year and a half later, the responding officer wrote later in his report that the facility didn't appear to have made, quote, any changes to prevent James or anyone else from escaping. Body camera shows him seemingly comparing the oversight to that within Utah's troubled teen industry.
They normally put somebody within, they call it arm's reach or away from them. So no matter where they go, there's somebody that's just dedicated their babysitting.
I wish we had staff for that. So I already have one resident on a one-to-one, and that's killing us.
Police and staff fanned out across the neighborhood and beyond.
Hopefully he turns up. I'm gonna go mope the area and just see what I can do.
But by the time they found Buchanan,
Sadly, the next day, James was found to have drowned in a nearby body of water.
Rachel Sykes is representing Buchanan's children in a lawsuit alleging failures in the facility's supervision and care.
I absolutely feel that this event was 100% preventable.
We reached out to Cascades Healthcare, the management company that operates South Ogden Post-Acute. Cascades issued a statement expressing condolences to Buchanan's family and friends and its commitment to providing safe, compassionate care to all residents. It added that state regulators conducted a thorough investigation and found no deficiencies in our care related to the wandering event.
We're seeing more and more people wander, or people get behind the wheel of an automobile, and it's really concerning.
Jeremy Cunningham leads public policy for the Alzheimer's Association's Utah chapter. He says wandering behaviors like Buchanan's are common among patients with Alzheimer's and other forms of dementia. The organization pushed for the creation of a Silver Alert program in Utah in 2019. Cunningham says the public notification system has since helped save more than 40 lives.
That 8 to 12 hours can determine if a person lives or dies.
As Utah's population ages, Cunningham expects wandering will become even more common.
60% of those individuals living with dementia will wander at least once.
Families struggling with a loved one's wandering sometimes turn to long-term care facilities in hopes that they can provide safer supervision.
They trust the facility, they trust that they have all of the tools and resources they need to keep their family members safe.
Sykes argues someone should never be able to wander away from a secure memory unit like Buchanan did.
Then that means that something has gone wrong and there's been a lack of oversight or safeguards or something that allowed that to happen.
Using a combination of police reports, facility inspection records, silver alerts, and news coverage, I've identified more than 200 wandering events from Utah's nursing homes and assisted living facilities since 2019. Most people were found safe, but inspection records show some were seriously injured. A South Salt Lake man spent a snowy night outside with one shoe off, developing frostbite. He'd wandered away at least 2 other times in the previous 3 months. A Sandy woman collapsed in freezing temperatures after exiting a door that was supposed to be locked. She had hypothermia by the time she was found. A Sandy patient who left her nursing home in mid-July sustained 2nd and 3rd degree burns when she fell on the pavement and couldn't get up. And a passerby found one resident partially unconscious in near 100-degree temperatures. If it's not the elements, experts say other dangers await.
They may experience a physical injury such as a fall. They may go into the highway and be struck by a truck. They may drown in a pond or a river.
Alon Caspi is a gerontologist and dementia behavior specialist who has studied the issue. He says even wandering events that end well need to be taken seriously.
So if we can identify the more minor incidents, we can prevent the more serious ones and save lives.
He says many wandering events are strikingly similar. In long-term care settings, they often result from boredom and lack of staff oversight, especially at night and on the weekends.
Well, it has to do with lack of meaningful engagement. It has to do with less staffing.
To guard against wandering, some facilities use tracking technologies, but those don't always prevent someone from leaving. The man we told you about earlier, who left his nursing home with one shoe on in the winter, was wearing a working Wander Guard bracelet when he left. But it seems that no one at the facility responded when the alarm sounded that he left the building.
What we need is the low tech. We can and we should think very seriously about investing in assistive technology, but it shouldn't be a substitute for the human connection.
The Utah Healthcare Association, which represents the state's long-term care facilities, declined an on-camera interview. In a statement, the association said wandering cases are rare, but that any incident where a resident was injured or worse is truly tragic. It added that it's a balance to maintain safety while also maximizing residents' autonomy.
It's so important to get the help that is needed.
If someone does wander, Cunningham says the community has an important role to play. He encourages everyone to keep an eye out for older adults who seem confused or out of place and to call for additional help if needed.
Who are you looking for? What are you needing? You look really hot. Can I get you a drink? I mean, you want to de-escalate and build trust with the individual.
2 years after Buchanan's death, Sykes says his children are still grieving their father. A veteran who served in the Vietnam War, a jack of all trades, and a devoted parent. She says they hope sharing his story will prevent other families from experiencing the same loss, and that their lawsuit will bring what they see as needed accountability.
They don't want this to happen to another family.
Taylor Stevens, Fox 13 News, Utah. My name is Taylor Stevens, and I'm an investigative reporter at Fox 13 News. Over the last few months, I've been reporting on Utah's long-term care industry, and we know that choosing a nursing home for yourself or a loved one can be a really consequential decision, and it's one experts say you should do some research before making that choice. So I wanted to quickly show you a tool that can help narrow down that decision and provide some additional information as you're looking for a nursing home. So this is the Center for Medicare and Medicaid's Care Compare tool, and this allows you to look at different types of Medicare providers. So you can look at doctors and clinicians, hospitals, but today we're going to focus on nursing homes, including rehab services. So if you click that on the side there, you can see that you can enter a location, and this just allows you to look at all of the Medicare certified nursing homes in a particular location. So you could enter a zip code, a city, or a state. I'm going to put Utah, just so we can see all of the nursing homes in the state. So once this pulls up, you can see here that we have 97 nursing homes in Utah and can see some information available for all of these different providers. So there's a lot of different ways you can look at this data. You can sort it alphabetically, you can look at the highest rated facilities in the state, you can filter by overall rating, and you'll see that each of these facilities has a star rating, which goes from 1 to 5, with 1 star being much below average, 5 stars being much above average. So we can sort by those. If there is a particular item that's important to you, for example, you want to see the best rated facilities by staffing, for example, you could also search by that. You can look at number of certified beds. So those are all different ways that you can look at this data. So let's sort this by highest rated facilities. We can see we have that here. And I'm just going to click into the first one on this list, just, no particular reason, just to kind of provide an example. So we can see that Stonehenge of Cedar City has a 5-star overall rating. And each facility, that overall rating is based on their rating on 3 different things below that. So we have a health inspection rating, a staffing rating, and a quality measures rating. You can also see when we click in, we have an address, a phone number, some kind of basic details about a facility. So within each of these ratings, we're able to click in and look at kind of what goes into that particular rating. So for health inspections, we can press View Inspection Reports, and then we'll be able to see a health inspection rating and the date of the most recent inspection and read their most recent inspection if we wanted to. So you can pop that open, see different items that they might have been cited for, a facility might have been cited for, and they have all of the most recent 3 years of complaint inspections and 3 years of infection control. So you can take a look at that. If we click out of that, we can also see some more details about a facility's staffing. So we can go in to view staffing ratings, and this has a lot of really helpful information, especially because a lot of experts agree that staffing is one of the highest predictors of quality in a facility. So here we can see the average number of residents in the facility per day and the total number of nurse staff hours per resident per day. What's helpful here is they give a national average, so we can see the national average is 3 hours and 54 minutes. Utah's average is 4 hours. This facility has 4 hours and 18 minutes, so can kind of compare both nationally and to Utah. We're also able to see breakdowns by registered nurse hours, LPNs, nurse aides. Some groups say it's important to pay particular attention to that nurse aide number because nurse aides do a lot of the direct care in a facility. We can see weekend number of nurse staff hours and also look at physical therapists, a little more details about RN staffing, and then we can also see staff turnover. So like this says, that's the % of nursing staff or administrators that stop working a facility within a given year. So we can see that here total nurse staffing turnover is 43.8%. That is below Utah's average of 51.3% and the national average of 46.4%. So a lot of good information there. If we click out of staffing, we can also take a look at quality measures. And there's a lot of different metrics that they look at for quality measures. So you can see under short stay quality measures, there's things like the percentage of short stay residents who were rehospitalized after admission, the percentage of residents who got antipsychotic medication for the first time. And again, you can see on some of these the national average and the Utah average, flu and pneumonia prevention measures, and then additional quality measures for short stay residents. Then we can also look at long stay quality measures. So all of that just kind of gives you a picture of what's going on in a facility and what some of these particular metrics, how they're being rated on those. So if we close out of that and keep going down, there's other things that we can kind of glean from this. We can look at fire safety inspections and emergency preparedness, and kind of see those inspections, view those inspection details. Do they have automatic sprinklers? When was their last fire safety inspection? Have they had any citations related to fire safety and emergency preparedness? Those are important things to know. And then we can click specifically in to view their penalties. So if a nursing home has a serious citation or doesn't correct that citation, they may receive a penalty. And so we can see, how many federal fines have they had in the last year, what were the amounts of those fines and the dates, and if they've had any payment denials by Medicare recently. So that can be helpful. And then here, if we keep going down, we can see some more details just specific to the facility. Do they participate in Medicare and Medicaid, or just one or the other? How many certified beds do they have? Things like that. Then we can get into some of the details of a facility's ownership. So here we can see what is the legal business name. So this facility is owned by the Kane County Human Resource Special Service District. It says it's a for-profit corporation, so we can see ownership type here. And we can also look at, get a little bit more details about the ownership, who has operational and managerial control. If it's part of a chain, which we can see that this one is, we can see that, and we can check and see what is the performance of this particular chain. So is this part of a chain that's highly rated or rated in a more, on the lower end of the scale? So if we go back, that kind of is a good overview of an individual nursing home, and that data is available for all of the state's nursing homes that we can check into. But one other thing just to look at really quickly, say you're between maybe two different nursing homes, there is a way that you can compare up to 3 different nursing homes. So here we'll just compare these top 3 because they're at the top of our list. If we press compare there, we're able to kind of quickly go through and see, what are the differences between these 3 facilities, their overall ratings, their health inspection ratings, some of those things that we were just going through earlier. We can see the number of certified beds they have, if they participate in Medicare or Medicaid, what their ownership type is. And so that can be helpful in kind of narrowing down if you're trying to make those decisions. And CMS stresses that this isn't necessarily a substitute for actually visiting a nursing home, and they recommend that you bring a list of questions, look out for things like people who aren't receiving the help that they need in a timely fashion, for odors, talk to some of the residents and their families and see how they are feeling about the care at that facility. But hopefully this is just a good tool that you can use as you embark on that journey to try and help narrow down that decision.
Some really bad things can happen, and some people can really be put in some really difficult and horrific situations.
Across the country, adult protective services agencies investigate claims of emotional and physical abuse, neglect, and financial exploitation of older adults. But in Utah, advocates say the system may not be catching everything it should.
We're clearly missing something.
I'm investigative reporter Taylor Stevens. Data shows Utah's APS is substantiating a far smaller percentage of claims than the national average, raising questions about whether vulnerable older adults are receiving the protections they need.
Abuse of older individuals is a complicated situation. Many don't want to talk about it.
As our Care in Crisis series continues, we examine why Utah confirms so few complaints and what makes these cases so hard to prove.
One of the things that we look at a lot is what's called self-neglect, where people just may not be taking care of themselves.
Nels Holmgren directs Utah's Adult Protective Services, which receives about 5,500 complaints of elder abuse, neglect, or exploitation each year.
Another growing one that we have is financial exploitation.
Investigators also look into cases Holmgren describes as rare but horrifying, like physical and sexual abuse.
Those do happen, and those are ones we investigate.
Following an investigation, APS caseworkers determine whether an allegation is substantiated, disproven, or inconclusive. And in Utah, the vast majority of cases fall into that last category.
They substantiate a very small number of claims, well below the national average.
Nate Krippis is an attorney with the Disability Law Center who's concerned about the quality of elder abuse investigations in Utah. After hearing his concerns, I asked APS for data on its investigations and found nearly 80% of all cases are deemed undetermined or inconclusive. Since 2019, Utah has substantiated an average of just 5% of cases, a number experts say is far too low to reflect reality. Nationally, the average is 29%, according to a 2021 report prepared for the U.S. Department of Health and Human Services that covered 36 states.
That would raise red flags to me extremely, that it's so much significantly less than the national level.
Sam Brooks advocates for better nursing home conditions through his work at the National Consumer Voice for Quality Long-Term Care. He believes Utah's substantiation rates don't reflect the true scope of elder abuse, which is frequently underreported nationwide.
When you have that small number of substantiation and that really significant number of inconclusive, that's very concerning.
I do have some level of concern about the investigations being done.
For Krippis, data showing so many cases are undetermined or inconclusive raises the questions of whether APS conducts thorough investigations. He says he's seen cases where investigators get different stories from an alleged victim and perpetrator and then end the inquiry.
It's like, well, we can't substantiate.
There's more to it than that.
Holmgren says APS investigators work closely with law enforcement partners and the Office of Licensing when needed,
to make sure that it's not just a he said, she said, and looking at patterns and things like that.
He told us he isn't concerned about low substantiation rates in Utah compared to nationally, pointing to differences in state laws around elder abuse investigations and to the limited scope of Utah's laws.
I do know that the bar is high in Utah, and again, I think policymakers in the state are very cautious about getting too involved in the lives of adults.
Holmgren also notes investigators face unique challenges when attempting to substantiate these cases.
Sometimes the older person is hesitant to pursue that because it is a family member.
Some victims may lack cognitive capacity to work with investigators, and alleged perpetrators in elder abuse investigations aren't legally required to participate.
And it can be really difficult if that person is not cooperative.
APS says high turnover and heavy caseloads also pose challenges for investigators. Records from the Department of Health and Human Services show that in the first half of last year, APS investigators in some positions handled more than 40 cases a month on average, almost triple the recommended load.
We're certainly aware of that issue and are working with executive and legislative branch partners to make inroads on that.
In 2024, the governor's budget recommended additional funds be set aside to hire new caseworkers and help reduce caseloads, but the legislature didn't approve it.
There were many requests that were not funded, but it's certainly something that we continue to work at.
In the meantime, Holmgren says the agency is trying to do as much as it can with the resources it has.
We're squeezing as much benefit out of the existing budget as we can.
Krippis hopes that state lawmakers will take a closer look at APS staffing, training, and investigative standards this year, arguing that the state may never uncover serious abuse without proper processes in place.
Ultimately, if something horrific is happening, this may be the only way we're ever going to find out.
Utah law requires anyone who believes a vulnerable older adult is being abused, neglected, or exploited to immediately notify Adult Protective Services or law enforcement. You can file a complaint on APS's website or by calling 1-800-371-7897. Taylor Stevens, Fox 13 News, Utah.
We can help with really any aspect that's important to the resident.
I'm Fox 13 investigative reporter Taylor Stevens. Over the last few months, I've been reporting on gaps in Utah's elder care systems, from concerns about quality of care.
There are real people in here who are suffering.
To what happens when older adults wander away from the facilities paid to protect them.
He couldn't tell you what day it was. He couldn't tell you what city he was in.
Too many families have lost loved ones with dementia to wandering.
So where can those with questions about their rights or concerns about their quality of care turn? Well, one option is the Utah Long-Term Care Ombudsman's Office.
We're like a mediator. If anyone has concerns with the way residents are being cared for in these facilities, they can come to us sort of as a third-party individual that can brainstorm solutions.
I sat down recently with Allie-Ann Sipes, the office's program manager.
I just want the public to know that we are ready and available to discuss concerns.
You can scan the QR code on the screen to find our full Q&A with the Long-Term Care Ombudsman's Office, to learn more about what they do and how they can help people who rely on long-term care facilities. Taylor Stevens, Fox 13 News, Utah.
We've seen some terrible examples.
Sex between nursing home residents and the unlicensed staff who work there. If it's consensual, it's legal in Utah, even when there's a clear power imbalance.
I just don't like that idea of a power dynamic being used to exploit our vulnerable.
Some advocates say these relationships expose a gap in Utah law, one that leaves vulnerable adults unprotected and allows employees to move between facilities with little oversight.
There's really no penalty or punishment for them on that. And so they can just hop from facility to facility across the state.
I'm Fox 13 investigative reporter Taylor Stevens. As our Care in Crisis series continues, I'll explain what we know about this problem and the complex debate over what accountability should look like.
An elderly gentleman, he thought he was in love with one of the nursing assistants.
Kaylin Wooten leads the Medicaid Fraud and Patient Abuse Division in the Utah Attorney General's office. Last year, she told lawmakers about a case involving an elderly man in a nursing home and a nursing assistant more than 50 years younger.
And that nursing assistant made him feel or told him that he would be able to move out of the facility, move in with her, and they were in love.
But Wooten says the relationship wasn't what it seemed.
In reality, she wasn't interested in men. She had a partner. She just slept with him because she wanted his money.
Mortified, the resident refused to move forward with prosecution for financial exploitation. And because he'd consented to the sexual relationship, Utah law offered no other avenue to hold the employee accountable.
Imagine when that relationship, if there was a real relationship, goes south, those same people have to bathe them and dress them.
Utah law clearly prohibits non-consensual sexual contact with patients in facilities. And it criminalizes sexual relationships between adults and minors, and jailers and inmates, even when both sides say it's consensual. But in long-term care facilities, consensual sex between unlicensed workers and residents is not a crime, and there are no professional consequences.
I think this is happening frequently enough. We probably need to look at what sort of standard we can set up and what sort of protections we can put in place.
Senator Jennifer Plum sponsored a bill last year to criminalize these relationships. She says it isn't clear how often this actually happens, since there's no reporting requirement. But
when you bring a conversation up like this with policy, it is interesting how many people say, oh, let me tell you what I saw happen, or let me tell you what happened in my family, or let me tell you what happened with me.
Plum, an emergency room physician, notes that entering a consensual relationship with a patient could cost her license.
If someone is not licensed, though, there really isn't a lever to have the ability, one, to potentially pursue any sort of consequences or justice from it, or to have any traceability from it.
Many employees in nursing homes and assisted living facilities aren't licensed, including food service employees and housekeepers. CNAs, who play a big role in providing care, are registered, not licensed. Without a license, no board can discipline them, so there's no record of past concerns if an employee goes to apply for another job.
That then brought stories out of individuals who had jumped from one facility to another facility to another facility.
Plum's bill ultimately failed to make it through the House. Not everyone agreed criminalizing these relationships was the right approach.
We really tried to find a compromise, but we ultimately couldn't.
Nate Krippis is with Utah's Disability Law Center, which opposed the bill. He argues it was too narrow, outlawing only the sexual relationships in long-term care facilities that involved so-called vulnerable adults.
My colleague uses a wheelchair, and if each of us were to engage in sexual conduct with a nurse who was providing us care or something like that, it would be a crime for that nurse if she or he did that with him, but not with me. And that really seemed discriminatory to us.
Krippis thinks a better solution would be creating a way to track misconduct through licensing.
If there's a subset of the healthcare industry that, the CNAs or the techs or whatever they are, that are unregulated such that they can go around and engage in activity they shouldn't, get fired, and then just go get another job, I don't think the answer is to criminalize that.
If there was a way to handle it with licensure, I'd actually prefer that. The unprofessional piece versus the unlawful piece, I like that better, but there's no way with a group of folks that are never all going to be licensed. There's just no way as a state that we could do that.
Plum told us she doesn't plan to pursue this issue in this year's legislative session, but may explore it again in the future. And while she believes criminal penalties are the best approach, she said she's open to other ideas for addressing these relationships.
It may be that all we do ultimately get out of this is that awareness piece.
Taylor Stevens.
People's maybe feeling that they can advocate for themselves or for their family members.
Fox 13 News.
To me, that's still a win.
Utah.
Placed her in a nursing facility, trusted that she'd be cared for.
As the state's population ages, some Utahns are facing difficult decisions about how to care for their aging grandparents, parents, and spouses. Sometimes they turn to assisted living facilities and nursing homes, trusting them to care for their vulnerable family members.
But instead, she died from injuries no one can explain.
I'm investigative reporter Taylor Stevens. I've spent months looking into facilities that care for Utah's aging adults. It's a system many say is failing to provide the quality care that families pay for, whether out of pocket or through their tax dollars.
In 2022, the National Academy of Sciences and Medicine actually made a report to Congress, and they said, I'm using their words, not mine, they said that this is an industry in crisis, that care is declining.
I've read thousands of pages of inspection reports at facilities, dozens of ongoing lawsuits, and dozens of police reports, all revealing pervasive deficiencies in quality of care at many Utah facilities.
My way of coping is just to not have needs. Is that right? No. I should be allowed to have needs.
From understaffing to deaths and sexual assaults to mental health needs ignored and residents wandering away.
People fear having to put a father, a mother, a spouse into a nursing home facility.
We'll look at how facilities are staffed and the consequences when there aren't enough people to provide care.
We look at it as a question of life or death for these residents.
We'll explore whether the oversight systems meant to improve these facilities are actually working.
I think ultimately, they have a duty to make sure that they look into it and try to find out what actually happened. And I'm certain, if something bad happened, people usually aren't just going to admit to it.
Experts say it's important to understand the challenges at these facilities and look at ways to improve conditions.
whether it's now or later, like a lot of people are going to end up here, and a lot of people are going to have parents or family members end up in these places.
If people aren't aware of it, nothing will ever change.
They're all tragic cases, though. Every single one of them.
I'm Fox 13 investigative reporter Taylor Stevens. In places families expect safety, some residents are being sexually assaulted. Oftentimes, they can't fight back, and some can't even tell you what happened.
There's supposed to be a system so the people that go there are safe.
In some cases, the abuse involves other residents, sometimes with limited mental capacity or dementia. In other cases, the perpetrator seems to know exactly what they're doing, including staff paid to provide care.
It's exceptionally complicated.
As our Care in Crisis series continues, I've been looking into the rare but serious issue of sexual abuse in Utah's long-term care facilities. I'll share the warning signs families can look out for and the changes some experts say could help prevent these cases.
She was stereotypical grandma, just loved her grandkids, loved kids.
This is how Brandon Harris describes his mom, Nancy, before her stroke in 2023.
Wasn't really the same after that.
Nancy, who we're identifying only by her first name at the request of her family, was discharged from the hospital to Heritage Park Healthcare and Rehabilitation in Roy, struggling to communicate and needing help with almost everything, from eating to getting out of bed.
So she is I would say about 100% relying on the staff there.
Harris and his wife, Candy Sousis, understood how vulnerable Nancy was, but they never thought to worry she might be sexually assaulted.
I thought the only worry I should have is like being there to comfort her, not worrying about her personal well-being in a hospital facility.
But one morning in 2024, Nancy was in the dining hall for breakfast when a male resident approached and groped her.
She might be able to say no on a good day, but a 2-year-old would have more power than her.
An employee later told Roy police that she physically pulled the other resident off of Nancy.
I would like to think, like, hopefully because of her stroke, that she didn't really have to endure it mentally.
She seemed just more scared, like she didn't understand what was going on, but something was going on.
The responding officer wrote in his report that this was the first time the facility had contacted police about the male resident's behavior, even though it was a known danger. The officer noted the man had previously lived in a different part of the nursing home, but was moved because he was sexually assaulting other residents.
You would think just anybody with logical thinking would, if you have someone that's predatorial to other women, you're not gonna just expose them to other women. It's kind of ridiculous that it could even happen in the first place.
In a statement, an administrator at the facility said, in part, that he couldn't discuss the specifics of this incident due to confidentiality requirements. But he affirmed that the health, safety, and well-being of each resident we have the privilege to serve is our priority at Heritage Park Healthcare and Rehabilitation. A July 2024 inspection report shows Nancy was one of 3 female residents who was sexually abused by 2 male residents in the facility around the same time. I've sifted through records across the state and found that Nancy's case is one of more than 36 allegations of sexual assault in Utah's long-term care facilities in recent years. I found federal regulators have cited Utah nursing homes at least 25 times since 2019 for failing to protect residents from sexual abuse.
Sexual assault is the most underreported type of abuse.
One study found about 2% of residents in long-term care facilities were sexually abused, about double compared to older adults in the community at large. But experts like Lori Smetanka, who advocates for better nursing home conditions as the executive director of the National Consumer Voice for Quality Long-Term Care, agree those numbers are likely undercounts.
When you do have people who are living with cognitive impairment, such as dementia or some other form of cognitive impairment, that raises some very specific challenges.
Like in Nancy's case, some of the sexual assaults we identified were by fellow residents, but in some cases, the alleged perpetrators were staff.
We have a sexual assault case where, after some of the sexual assault started, the patient, it was put in a chart, this patient is found hiding under the bed.
Jeffrey Eisenberg is an attorney with the Elder Care Injury Group, which is suing over a sexual assault at Spring Gardens, an assisted living center in Heber. Their complaint alleges an uncertified nurse assistant repeatedly sexually assaulted a woman with advanced dementia and memory care. During that period, the lawsuit says staff found the woman hiding on the floor.
And you can imagine that if an elderly person is being sexually assaulted, the terror that that person's going to have if they're going under the bed.
Court records show the employee admitted to assaulting the woman and to attempting to assault another female resident with dementia. He said he thought he could easily do it and get away with it because the residents can't do much about it. He pled guilty last year to attempted rape and object rape, first-degree felonies, and was sentenced to no less than 5 years in prison. An attorney representing Spring Gardens did not respond to our request for comment. Advocates say knowing the early warning signs is often the only way families can intervene.
If they get very withdrawn or become fearful around another particular person, that's something that should raise some red flags.
Smetanka says watch out for things like unexplained bruising or sudden behavior changes. She says employee screenings and background checks can help reduce the risk of sexual assaults in facilities. The lawsuit at Spring Gardens alleges those weren't appropriately done. Improved staffing can also help.
The more eyes that are available in a nursing home to monitor, to check in on residents can ensure that residents are protected.
The whole sexual assault would not have happened if they had the staffing in the room.
After her mother-in-law was assaulted, Susis went to the nursing home to talk to police. That's when records show the man touched her.
That same resident that did this had just smacked my bottom, just right there, in front of everybody.
She told police she wanted the man gone, but when an officer tried to form a safety plan with the facility,
they basically told us that they cannot guarantee that this won't happen again.
a police report says the male resident was ultimately moved out of the nursing home. The county attorney's office declined to press charges, telling the family
he wasn't mentally fit.
Harris agreed with that decision, saying he doesn't believe the man understood what he was doing.
I hold the nursing home responsible because it's their duty to protect my mom and take care of her and provide her with care.
Now, he and Susis want others to be on alert for something he wishes no family would ever have to worry about.
It should never happen. It should just be zero. It shouldn't be a sexual assault, a broken bone, anything like that for our elderly people, not just my mom.
If you believe a vulnerable adult is being abused, neglected, or exploited, Utah law requires you to immediately notify Adult Protective Services or law enforcement. You can file a complaint online or by calling 1-800-371-7897. Taylor Stevens, Fox 13 News, Utah.
There's a real sense of isolation and loneliness that can set in. They feel as though they've done what they can do as much as they can do, and so why does the world need me now?
As some older adults struggle with their mental health,
in many facilities, the staff are not adequately trained to not only address mental health needs, but also to identify them.
experts say it can be difficult for those who live in nursing homes to get the help they need.
And that is a huge gap in our system statewide.
I'm Fox 13 investigative reporter Taylor Stevens. As our Care in Crisis series continues, I'll tell you about the unique challenges facing older adults in long-term care facilities who are struggling with their mental health, and what happens when emotional crisis meets a system mainly built for physical care.
What we realized was that there were a lot of people who had social anxiety issues if they've gotten older. They are very anxious. Some of them are just so isolated.
Ann Asman is a gerontologist who manages the University of Utah's Geriatric Psychiatry Clinic. The center works with adults 60 and older with mental health challenges, a group she says needs more help than some realize.
They're really facing the unknown. And facing the unknown is scary, causes anxiety. It can cause people to withdraw and become horribly depressed.
While Utah has focused heavily on youth mental health, data shows suicide risk increases substantially after age 65. And some research indicates that the transition into long-term care can come with several risk factors for suicide among older adults, including physical health limitations and social disconnectedness.
People that enter long-term care facilities are at greater risk of depression. Often they feel isolated.
Lori Smetanka advocates for better nursing home conditions as the executive director of the National Consumer Voice for Quality Long-Term Care. She says another challenge is that people with pre-existing mental health needs are often placed in nursing homes.
Frankly, because there's a lack of other good housing options in communities for them to go.
Our mental health system really doesn't exist.
Nate Krippus, an attorney with Utah's Disability Law Center, also sees large gaps in our mental health systems.
But I do think that probably is leading to this problem where you're having a lot more folks with mental illness end up in nursing facilities than should be there.
A 2010 study estimated that between 65 and 90% of nursing home residents had a significant mental disorder, and the number with serious mental illness has been increasing. But experts say the system was never meant to handle mental health at this scale.
And those facilities are not equipped to, I think, provide the support services that that population needs.
I've reviewed thousands of pages of inspection reports at Utah's nursing homes and found at least 18 examples of residents who attempted suicide, expressed thoughts of suicidal ideation, or engaged in self-harm since 2019. In several cases, the residents never received needed mental health services from the facilities paid to provide their care, despite clear warning signs or even outright cries for help. For example, records show a Salt Lake City nursing home resident who had repeatedly attempted suicide, expressed suicidal ideation, and self-harmed, felt she wasn't getting the care she needed. At one point telling staff she'd been hearing voices for the last 3 weeks, but no one was doing anything about this. A federal inspection report found 21 separate notes in which employees downplayed the woman's symptoms, referring to her as needy, attention, and medication seeking. An administrator told regulators she was probably more psych than we can handle, but everyone else has refused taking her. In other facilities, similar patterns, including a Mill Creek resident who attempted suicide multiple times but received only 2 mental health evaluations over the course of his 13-month stay.
I see missed opportunities all the time.
I ran some of these cases by Asman, who believes they're indicative of a lack of mental health infrastructures in facilities.
When you're going to a nursing home, whether you have a physical issue or a mental health issue, the mental health issue always is set aside for the physical issues. I don't think there's nearly enough training.
Smetanka agrees, noting that many facilities don't employ a mental health professional and that other employees may miss important warning signs.
They really need education on what are the steps that they should be taking, who should they call, and that they need to be taking it seriously.
They are calling us concerned about residents, trying to find connections to address the mental health needs.
Alliann Sipes advocates for residents in nursing homes and assisted living facilities as the program manager for the state's long-term care ombudsman office. She says she often hears concerns from facility staff who feel stretched thin and unable to address resident mental health needs.
Sometimes they're so focused on doing the daily med passes and all of the personal cares that they have to do that it's easy to get tunnel vision sometimes.
Sipes says some nursing homes have recognized the need for additional resources and are now contracting with private therapy companies.
Naturally, we're going to have facilities that lag behind a little bit as well.
The Utah Healthcare Association, which represents the state's long-term care industry, said in a statement the facilities are also expanding staff training and adapting care models to better support residents with behavioral health problems. But the association noted that nursing homes are not psychiatric hospitals, and that this is a broader systems issue that requires a serious examination of our nation's mental health policies and support infrastructure to provide support for residents in the most appropriate setting. The state health department says the community can help support the mental health of older adults more broadly by expressing appreciation and maintaining regular contact with those experiencing social isolation or depression.
We were born and raised in an environment where mental health was really not discussed.
At the geriatric psychiatry clinic, Asman tries to reduce the stigma of mental health among older adults, teaching that it's as important a part of aging as physical health, and that even though life will look different,
it's a mindset. You have to understand that you may have a mobility issue. Okay, but that doesn't necessarily mean you can't do this with adaptation.
there are so many reasons.
Your cane doesn't have to be a cane. It can be a ski pole.
To keep going.
It doesn't have to be ugly and,
Taylor Stevens.
I just think that we have to think beyond.
Fox 13 News.
We've got to think beyond where we are.
Utah. And if you or someone you know is struggling with mental health, there's always help available. You can call or text the 988 Lifeline, which provides immediate emotional and mental health support 24 hours a day, 7 days a week.
Having to live on the streets or in your car or sometimes in a shelter are not the most conducive and healing environments for any sort of illness.
Older adults with medical vulnerabilities discharged out of nursing homes and assisted living facilities and into homelessness.
We need to do a better job of supporting people who have worked their entire lives and now are at retirement age and are coming up with these medical issues.
It's an issue Utah's long-term care ombudsman says is happening more frequently.
This is a silent issue. Nobody's really talking about it.
I'm Fox 13 investigative reporter Taylor Stevens. As our Care in Crisis series continues, I'll explain how shrinking social safety nets and Utah's housing crunch are leaving some older adults out in the cold.
They escorted him outside without his walker and said, "Do you want me to call you an Uber? That will cost about $500.
Allianne Sipes is the program manager for Utah's long-term care ombudsman office, which advocates for residents in the state's nursing homes and assisted living facilities.
And the residents said, "No, I'll hitchhike."
She's describing what happened to one man who didn't have any family or a place to live after he was discharged from a long-term care facility to a friend's house more than 2 hours away.
So the facility staff said okay and left. And he hitchhiked to his friend's house. And he eventually ended up back in the homeless shelter.
Nursing homes are required to find a safe location for residents discharging out of their care.
But the word safe can be subjective. What constitutes a safe discharge?
The Ombudsman's office started tracking discharge locations in March 2024 and found since that time that 57 nursing home residents have received discharge notices with a hotel or homeless shelter as their next destination.
48 of those 57 were ultimately discharged. The other 9, with Ombudsman assistance, we were able to prevent that discharge from occurring.
34 others were discharged to unknown locations. And it's not just nursing homes. In fiscal year 2025, the Ombudsman tracked 5 assisted living residents discharged to homelessness and 12 others whose destinations were unknown.
It's a little bit more gray for assisted living facilities. Yes, they also are supposed to be finding a safe discharge location, but it's unclear whose responsibility it is sometimes to find that.
I've read thousands of pages of inspection reports at Utah nursing homes which provide additional details about some of the discharges. For example, records show one resident with dementia became confused after he was discharged to a hotel. He soon ended up in the emergency room after he was found wandering the streets in the rain and knocking on the door of his childhood home. In another case, a 73-year-old woman who'd been living outside without adequate shelter was admitted after her toe was amputated due to frostbite. After discharge, she had nowhere to go, so the facility dropped her off at a bus station.
Sometimes the default thought is, well, they can just go back to homelessness.
So why is this happening? Well, data shows older adults are increasingly vulnerable to homelessness, with the population of homeless adults over 64 growing 42% across the state last year.
Many of our older adults have lived stably in the community for many years on their Social Security income or a veteran benefit or something like that. And when their rent raises $200 a month, they can no longer afford it.
Michelle Flynn is the executive director of the Road Home, which provides services to people experiencing homelessness. She says more older adults are facing homelessness, at least in part, because of increased housing costs.
We've had people who own their own homes and could no longer afford because they couldn't afford to pay the taxes anymore and the expenses.
Becoming homeless can lead to new health needs or worsen pre-existing ones.
Having a chronic health condition and then experiencing homeless on top of that would not be beneficial, right?
Eventually, someone may become sick enough to be admitted to a long-term care facility where they can finally access needed health care supports. But
once they're stabilized, they no longer are eligible for Medicaid. And so now they have to discharge.
Because Utah's stock of affordable housing is so low, it can be difficult to find a place for them to go, leading some right back to homelessness where they may become even sicker, starting the cycle all over again.
So we see a wide variety of facilities really trying to find solutions. There just isn't any out there, to facilities who are just really just putting them on the sidewalk and saying, the rest is up to you or family.
The Utah Healthcare Association, which represents the state's long-term care industry, said in a statement that providers work with families, case managers, and community partners to find good discharge options. And some facilities even keep residents longer than they're reimbursed for as they search for solutions. When residents are discharged to a shelter or other temporary option, the association said that's not something facilities want. It usually reflects bigger challenges we're seeing in Utah, especially around affordable housing, behavioral health resources, and limited community placements.
The need of people who are showing up at our front door is much higher than it used to be.
After the pandemic, the Road Home opened a facility in Sandy with space to serve around 165 people experiencing homelessness who are 62 and older or who have medical vulnerabilities. When the center opened,
we were overwhelmed with referrals from skilled nursing facilities, from senior housing facilities, from hospitals, from all these partners in the community who had people with no place to go.
The facility filled up immediately and demand continues to outpace supply.
I think if we could expand on that program, that's the direction we should be going.
Flynn believes there could also be more coordination between Utah's long-term care facilities and homeless shelters to better help those who need a safe place to land after discharge.
Ideally, when people are finished with their stay at a skilled nursing facility, that it would be a supportive housing or senior housing that they would move into. The more we're all talking and collaborating and sharing information, the more we'll be able to help people more quickly.
The Utah Healthcare Association agreed that coordination across healthcare, housing, and social services will be important to find solutions moving forward.
We talk a lot about, in this example, what is the intervention point between discharge of this nursing home and so they don't end up in the street.
Tyler Riedesel is an epidemiologist with the state who studies health outcomes for unsheltered populations. He believes the most important place to focus is on preventing people from ever becoming homeless in the first place.
But if we look a little bit more upstream before they even came to the nursing home, what are things that we could what are areas that we could work on there?
As Utah's population ages, Riedesel believes discharges to homelessness pose important questions that we need to grapple with as a community.
Is that something that people are comfortable with? Is that something that we would want our grandmother, our grandfather, ourselves, do we want that own experience to happen? And I would venture to say that most people would say not.
Taylor Stevens.
I think that we are
Fox 13 News.
Creative enough to come up with solutions to not see what things like this happen.
Utah.
Having to live on the streets or in your car or sometimes in a shelter are not the most conducive and healing environments for any sort of illness.
I'm Fox 13 investigative reporter Taylor Stevens. As part of our Care in Crisis series, we recently reported on residents at Utah's nursing homes and assisted living facilities being discharged out of care and into homelessness.
This is a silent issue. Nobody's really talking about it.
Discharges or transfers from care can have serious negative effects on residents, according to the state's long-term care ombudsman office. Those living in nursing homes have the right to appeal a discharge.
But assisted livings are in this weird space where they don't have any way to dispute the claims being made about them from facility staff.
That leaves assisted living residents with fewer protections than people much less vulnerable, according to the state's long-term care ombudsman.
If you are renting just a normal apartment from a landlord, there's a way to dispute that.
A bill that would have created a discharge appeal process for assisted living residents didn't make it far during this year's legislative session. But Allianne Sipes' office says it's looking at other solutions.
We are trying to address that issue with the assisted living industry to try to figure out a solution. So I think implementing some sort, finding a way to allow residents to dispute those claims will also strengthen the protections of assisted living.
There are real people in here who are suffering.
For months, we've been reporting on allegations of poor quality care in Utah's government-owned nursing homes, including questioning where $1 billion in federal funds meant to improve care have gone.
I'm just not sure that, those dollars are being used in ways that enhance resident well-being and safety.
Now, a new state audit backs up our reporting. It shows that 51% of the money, or about $450 million, wasn't actually spent at the nursing homes the audit says the funds were meant to help.
I have a mother who was in a long-term care facility. Just to argue that the long-term care facilities were fully funded? No, they weren't.
I'm Fox 13 investigative reporter Taylor Stevens. As our Care in Crisis series continues, I'll tell you what the audit found, how the owners of these nursing homes are responding, and what questions still remain.
She might be able to say no on a good day, but a 2-year-old would have more power than her.
In March, we told you about Brandon Harris's mother, Nancy, a resident at Heritage Park Healthcare and Rehabilitation in Roy, who was sexually assaulted by a male resident in an incident her family attributes in part to poor staffing.
The whole sexual assault would not have happened if they had the staffing in the dining room.
We spoke to Harris and his wife, Candy Sousis, last fall. That's when they learned Nancy's nursing home is owned by Beaver Valley Hospital, a city-owned hospital in rural Utah that holds the licenses for 44 of Utah's 97 nursing homes. They were also surprised when we showed them state records revealing that Heritage Park has received $18.9 million since 2018 through a federal program meant to improve care at Utah nursing homes.
That just doesn't make sense to me at all.
I don't know the cost of everything medical, but it definitely does not look like they're reinvesting their money back into the business.
Heritage Park is one of 75 government-owned nursing homes across the state eligible for additional Medicaid dollars through a state program known as the Upper Payment Limit. State records show some facilities have received even more money through the program, like St. Joseph Villa in Salt Lake City at $51.8 million and Sandy Health and Rehab at $33.8 million. But a new state audit found that most of the money wasn't spent at the nursing homes or on the patients it was meant to help.
It is set for a specific purpose, and in this case, it is set for improving care in a skilled nursing facility.
Utah State Auditor Tina Cannon's office found nursing homes spent just 49% of nearly $1 billion in federal funds through the program over the last decade. The hospitals used the rest, 51%, for administrative costs, owner compensation, and hospital operating expenses. The audit also found the Department of Health and Human Services collected excess administrative fees for overseeing the program.
The money is being taken away from its intended purpose.
Cannon says the Utah Supreme Court has established a reasonable administrative fee as 1 to 3%. The hospitals have collected at least 17 times more than that through the upper payment limit.
It's outrageous by anyone's definition of a reasonable administrative fee. 51% is not reasonable. It is beyond.
Under the upper payment limit, nursing homes that are owned by government entities like cities or counties are eligible for additional federal dollars. Along with Beaver Valley Hospital, the other major players referenced in the audit are Gunnison Valley Hospital, which owns 15 nursing homes in the state, and Kane County Hospital, which owns 5. But the audit found a significant portion of the funds it says were meant for their nursing homes actually went to improving care at their rural hospitals. Beaver Valley, for example, told us last fall that upgrades at its hospital and its new wellness center, complete with a recreation pool and lazy river, were funded with a portion of upper payment limit dollars. The audit released this month doesn't mention those projects specifically, but says hospital expenditures appear to be contrary to the purpose of the program's funds.
This is not how you fund rural health care.
The audit recommends the Utah Health Department either stop allowing upper payment limit funds to be used for hospital-related expenses or explicitly allow those uses in the state's plan.
If you intend to fund rural health care, fund rural health care. But do it openly, do it transparently, and be very clear in how you're funding it.
What the audit has found is what we have been suspecting for a number of years now.
Barry Toon is an attorney with the Elder Care Injury Group, which is pursuing medical malpractice complaints against several Utah nursing homes in the upper payment limit program.
We're seeing all of the problems, all of the injuries, all of the death.
He shared an analysis with us last year showing that the quality of care at upper payment limit nursing homes is worse than at facilities that aren't part of the program and haven't received those extra federal funds. Both the hospitals and the State Department of Health and Human Services pushed back on that analysis. But Toon believes this audit provides some insight into why the money hasn't had a bigger impact.
There are so many ways that funding these facilities directly, training, all kinds of things, has a direct impact on the quality of care for these individuals.
That $500 million would have gone a long way.
Would have gone a long way. You can hire a lot of nurses and a lot of CNAs, and you can improve the quality of food, you can improve the quality of a lot of things with $500 million.
Toon stresses that he supports the purpose of the upper payment limit program.
I want more dollars to be there to take care of people. My problem with the way the system is operating is that those dollars are not being used for the purpose for which they were intended.
In a response to the audit, an attorney for Beaver Valley, Gunnison Valley, and Kane County said the hospitals had lawfully used funds through the upper payment limit for other healthcare costs only after all nursing facility costs have been paid. They argue that approach is in compliance with state and federal law, the state Medicaid plan, and the state's upper payment limit contract, and has improved care for nursing home residents and healthcare in rural Utah. Release of the audit, they warned, would sow doubt in the upper payment limit. They wrote that it would literally destroy an essential state program, cause the loss of nearly $100 million annually for health care, cause dozens of nursing facilities to close their doors, and leave thousands of patients annually with no professional care options. We reached out to the attorney who represented the hospitals in their response to the audit, but didn't hear back.
It's not lost on me that Beaver Valley Hospital, as a small rural hospital, Gunnison Valley, Kane County, can afford one of the largest regional law firms in the country to represent them in this case. If you have to hire a very expensive defense attorney to provide your response to a state audit, you're making my point for me.
Cannon notes this audit didn't look at where money that wasn't spent in nursing homes actually went, or at the effectiveness of the program. But she says those questions may be the focus of future inquiries.
These are conversations that are going to continue within the state of Utah over what their plan is for Medicaid funding and funding rural health care.
We are trying to get additional answers through the discovery process, through litigation.
Toon says the Elder Care Injury Group is also working to understand where money has gone at the facilities they're suing.
So we will fill in the gaps as best we can as we go along.
They should be getting more than what they have.
Sousis believes upper payment limit funds could make a big difference for not only her mother-in-law, but also for other patients across the state who rely on these facilities for care each day. But only if the funds are actually spent at the nursing homes.
I mean, they could put $1 million back into there and it'd be a lot more different, a lot different, a lot better. And it's really sad.
Taylor Stevens, Fox 13 News, Utah.
I have a mother who was in a long-term care facility. Just to argue that the long-term care facilities were fully funded? No, they weren't.
I'm Fox 13 investigative reporter Taylor Stevens. We recently told you about a new state audit that showed hundreds of millions of dollars meant to improve care at Utah's nursing homes never made it to the facilities or the patients the money was meant to help.
The money is being taken away from its intended purpose.
State Auditor Tina Cannon's office looked at spending by the 3 main government-owned hospitals that participate in the program: Beaver Valley, Gunnison Valley, and Kane County. The audit found the nursing homes they own spent just 49% of nearly $1 billion in federal funds that flow to them under the state's upper payment limit program over the last decade. The hospitals used the rest, 51%, for administrative costs, owner compensation, and hospital operating expenses.
It's outrageous by anyone's definition of a reasonable administrative fee. 51% is not reasonable. It is beyond.
Since our story aired, we've received questions about which facilities are part of this program and how much money they've received. Now we have answers. We spent hours poring over a spreadsheet the State Department of Health and Human Services publishes to track those dollars. I've compiled a list on our website of all of the facilities that are part of this program, who owns them, who operates them, and how much money they've received. You can scan the QR code on your screen to find that list. In studio, Taylor Stevens, Fox 13 News, Utah.
You really see the same problems over and over again.
Medication errors, improper monitoring, poor staff training.
Some of those things end really badly for people because they're sick, they're old.
I'm Fox 13 investigative reporter Taylor Stevens. Experts say these types of problems can sometimes lead to the premature and preventable deaths of Utah's elderly and disabled in long-term care facilities.
What we hope is that we're going to shine a light on this problem.
I've been looking into 24 deaths in Utah's assisted living facilities and nursing homes since 2019, as detailed in inspection reports and lawsuits.
Why didn't they give her emergency medical service? Why didn't they call 911?
As our Care in Crisis series continues, I'll explain why some are calling for the state to review more of these cases so they can identify root causes and better protect those who rely on this care.
Mom's life was dedicated to service.
Scott Diddy's mother, Ruth, spent her career as a registered nurse.
Training people to provide professional, expert, and compassionate service to those that need. That was her whole thing.
As Ruth began exhibiting early signs of dementia, her family wanted to make sure she received the same quality care she'd spent her life giving others.
Every one of us said, Mom, you can come and live in our house, we'll take care of you. And she was always kind of like, oh, I don't want to be in the way, I don't want to be a bother. She kind of wanted her own place.
Eventually, the family helped Ruth move to Covington Senior Living, an assisted living center in Orem. As his mother's health continued to decline,
she started falling regularly.
Then the day came when Ruth took her last fall, down an unsecured stairwell at Covington after attending church one Sunday in early 2024.
They found her there 6.5 hours after she fell. They didn't call 911. They didn't bring a doctor in. They just lifted her up and had her walk down the hall, or had her walk up the stairs, put her in a wheelchair, and took her to her room, put her in bed.
She died a few days later at the facility on January 24, 2024, from what the lawsuit says was an undiagnosed brain bleed from the fall. The complaint also alleges Covington prioritized financial gain over Ruth's safety before her death by failing to reevaluate her services or to transfer her to a more secure memory care unit as her health declined. Instead, the family spent nearly $5,500 a month for add-on services the lawsuit says cost more than memory care would have. The add-on services included 2-hour checks, which don't appear to have been performed the day Ruth spent 6 hours at the bottom of the stairwell.
I hate to make it all about money, but if you're talking dollars and cents, it would have saved us money for Mom to be in memory care unit, and it would have taken better care of her.
Covington denies that claim and other allegations of wrongdoing in court documents. In response to a request for comment, the facility released a statement saying, "Ms. Diddy was a beloved member of the Covington senior living community, and our condolences go out to her family." Covington cannot comment further. This case is in litigation and needs to proceed through the court process, not the media.
People want these facilities to be safer than they are, and they want them to be better staffed.
Jeffrey Eisenberg is an attorney with the Elder Care Injury Group, which is representing Diddy's family in its lawsuit and pursuing dozens of other medical malpractice complaints against Utah nursing homes and assisted living facilities.
More than half of them involve mistakes that were so bad that the patient died.
Some of their cases involve deaths allegedly resulting from sepsis, a severe bodily response to an infection. The complaints allege that resulted from untreated urinary tract infections or pressure wounds. Another of Eisenberg's lawsuits claims a patient at high risk for aspiration received a diet he couldn't safely eat and then choked to death on a breakfast burrito.
It was well understood that this person had severe difficulty swallowing. When the person started to choke, we think the evidence is going to show that the people in the facility didn't know what to do to keep that person alive.
Beyond the Elder Care Injury Group's lawsuits, we've identified at least 8 other ongoing lawsuits alleging that deaths in nursing homes or assisted living facilities resulted from negligence or poor quality care. The Utah Healthcare Association, which represents the state's long-term care industry, declined an on-camera interview, but noted in a statement that allegations raised in lawsuits are not findings of fact, and that each case must be evaluated within its specific clinical and regulatory context.
We hope that the accountability that the system brings is part, it can only be a part, but it's part of a solution.
I've reviewed thousands of pages of federal inspection reports and found regulators have cited Utah's nursing homes for issues related to at least 6 deaths since 2019. Some of those involved medical mistakes, as in the case of a woman who died of a potential accidental overdose after a nurse mistakenly gave her another patient's medications, then allegedly gave the resident all of her own medications as well, and didn't inform a doctor until her vitals began to drop. In another case, a nursing home resident with a severe pressure wound went septic and died in the hospital. Federal regulators said a doctor had never examined him at the facility.
We've just seen a lot of problems in long-term care.
Nate Krippus is an attorney with Utah's Disability Law Center. He feels state regulators haven't done enough to address what he sees as pervasive issues in Utah's long-term care facilities. One change he'd like to see is additional oversight through the state's fatality review committees, which take a closer look at deaths in state-operated or regulated systems.
I think the state really should conduct these reviews system-wide.
The goal of these reviews is to identify systemic changes, whether in law, policy, or training, that can improve services and prevent future client deaths.
Whether that is a perfect system and whether those reviews are finding all the problems they should, when a person dies in a nursing facility or an intermediate care facility or something along those lines, there is no similar review.
DHHS does review deaths of older adults in assisted living facilities and nursing homes if the person had an open case with Adult Protective Services at the time of their death or in the year before, but only if their death was deemed a homicide, suicide, or undetermined cause. Krippus says he's asked lawmakers about expanding those reviews to encompass more deaths of older adults, but he feels there's a presumption that elderly people in these long-term care facilities were bound to die.
I'm not going to disagree that when you're talking about an aging population, a lot of people probably are going to pass away in facilities. But again, I don't think it's too much to ask to then really take a look at what were the circumstances.
A DHHS spokeswoman told us the fatality review committees follow state law to determine which deaths qualify for a closer look, and that any expansion to those definitions would require legislative action. Asked about the idea of expanding reviews, the Utah Healthcare Association said it's always open to conversations about how to improve resident safety. But it said any additional review of facilities must be clearly defined, avoid duplicating existing oversight, and be focused on objective, evidence-based improvement rather than creating new layers of punitive review.
I would love to see change in the senior care industry.
For Diddy, he believes there were multiple points where his mother should have received better care, and he thinks her death was ultimately preventable with systemic changes, like the ones the fatality review committees explore, including better staffing, training, and oversight.
She devoted her life to training people to take care of others. And the tragic irony of
Taylor Stevens,
of how incompetence in the medical field contributed to her death is just
Fox 13 News,
it's just beyond words.
Utah.
People want to provide good care.
Nurses and certified nursing assistants play a vital role in caring for the disabled and elderly residents who live in nursing homes around the country. So it's probably no surprise that experts agree well-staffed facilities tend to have higher quality care than understaffed ones.
We look at it as a question of life or death for these residents.
Yet federal data show about a third of Utah's nursing homes don't have enough staff to provide the care residents rely on.
Biggest issue is just chronic understaffing, and I did see that.
I'm Fox 13 investigative reporter Taylor Stevens. As our Care in Crisis series continues, I'll explain why so many people believe improved staffing is key to improving care in these facilities.
She was strong, independent. She made all of her children, though she's the reason why we're the way we are with our strength.
That's Lessa Fanoti talking about her mother, Lou Toniola, a pair so close it seemed nothing could keep them apart.
My mom just gravitated to where I was at, whether I liked it or not. Yeah.
When Fanoti moved to Utah, Togiola wasn't far behind. Then, after her mother suffered a stroke in 2020, Fanoti made the difficult decision to move her into a nursing home. There were tight restrictions at the time due to the coronavirus pandemic. So Fanoti, a registered nurse, decided to apply for a job at the facility.
Everything was pretty restricted. Visitors weren't allowed, so I just kind of picked a place and decided that I'd work there.
Fanoti had spent most of her career working in hospitals, never in a nursing facility. She says she immediately saw red flags.
There's a chronic issue with understaffing, and that causes delay in care, and this type of system is just so stretched so thin. I feel like that's what ultimately cost her life.
In April 2023, Fanoti received a call from the nursing home where she no longer worked. A scan showed her mother's femur was broken.
My mom's whole left side was bruised. It wasn't just a bruise, it was bruises, multiple bruises along her left side. I was shocked, I was angry. As her daughter, I was heartbroken.
Fanoti filed a lawsuit against the facility alleging there was no documentation explaining how the injury could have happened, especially to an immobile patient like her mother.
And as a nurse, I knew this wasn't something my mom could have done on her own. She completely depended on staff for care.
At the hospital, doctors recommended surgery. Fanoti agreed.
But unfortunately, my mom, she pretty much crashed during recovery. And she passed later that night.
Finoti's lawsuit alleges, among other things, that the facility failed to provide sufficient staff to meet the needs of her mother and other residents there. The facility has denied allegations of wrongdoing in court filings. We reached out for comment to the management company that operated the nursing home at the time of Togiola's death, but didn't receive a response.
If you don't have enough people to take care of these residents, things will get missed. Mistakes will get made. And those mistakes have very real consequences.
Barry Toon is an attorney with the Elder Care Injury Group, which is representing Finoti in her complaint. The firm is also pursuing medical malpractice complaints against several other Utah nursing homes, and Toon says staffing often emerges as an issue in these cases.
When you are understaffed and undertrained in a facility, you see more falls, you see more pressure ulcers, greater dehydrations, greater hospitalizations, and that ultimately leads to higher mortality rates.
Federal data shows about a third of Utah's nursing homes have below average or much below average staffing. I've reviewed thousands of pages of federal inspection reports and found more than a dozen examples of Utah facilities cited for inadequate staffing since 2019. In one case, an Ogden facility allowed a nurse to keep working even after she was disciplined for missing narcotics, came to work appearing intoxicated, and was reportedly regularly sleeping on the job, and after a resident raised concerns about safety when she was working. An administrator told regulators the facility couldn't send her home even if she was impaired because I don't have anyone else to work, according to an inspection report. In another case, a Mill Creek nursing home was cited after a laundry staffer was asked to work as a nurse assistant, even though she wasn't trained or certified for the job. She was left alone to cover the floor for 3 hours with no other aid. And in an Orem center, a resident told inspectors the facility was so understaffed that she could be dead and no one would notice.
If you start getting too low in staff, not only are people not reaching their highest practicable levels, but they're not even getting basic care.
Lori Smetanka advocates for better nursing home conditions as the executive director of the National Consumer Voice for Quality Long-Term Care.
And that's what's happening in too many facilities right now because there's not a standard that's being adequately interpreted or enforced.
Her group's research identified a correlation between high staff turnover and abuse. They found high staff turnover is related to issues like poor pay, impossible workloads, and inadequate training.
By putting in place better jobs, paying the living wages, that really would go a long way towards reducing turnover.
The federal government requires nursing homes to have sufficient staff to meet resident needs. A vague standard, Smetanka says, gives facilities a lot of discretion. Her group supported new staffing rules created under the Biden administration, which the Centers for Medicare and Medicaid Services repealed late last year. The rules would have created minimum staffing standards in nursing homes and required a registered nurse to be on site 24 hours a day, 7 days a week. Data from the American Healthcare Association, which was opposed to the rule, shows 30% of Utah nursing homes weren't meeting the proposed staffing hour standards, and about 70% didn't have a registered nurse available 24/7.
Really, only the bottom, the worst of the worst, would be primarily affected and have to raise their staffing levels because there are already a number of facilities that already meet those levels.
Still, researchers at the University of Pennsylvania estimated the standards would create a big impact nationwide, saving approximately 13,000 lives each year.
That's significant.
But the nursing home industry lobbied against the rule. The American Healthcare Association and the National Center for Assisted Living called it an unfunded mandate that could lead facilities to downsize or even close. The Utah Healthcare Association said the rule would cost the state's nursing homes an additional $15 million each year and require them to hire 310 additional staff. The association declined an on-camera interview but said in a statement that the staffing rule was completely unattainable for nursing facilities to comply with, as the state faces workforce shortages. We need targeted investments, not blanket mandates, to grow our long-term care workforce, the association said, noting that it's been working with policymakers to help them better understand our unique population and labor market situation.
To say that a staffing rule that will assure better patient care is going to cripple them, I think is is really ridiculous.
But Smetanka pushes back on claims the staffing rule would have been catastrophic for the industry.
These are multi-billion-dollar industries.
While some groups have celebrated the staffing rule's repeal, others say it will leave understaffing the status quo in many nursing facilities.
Ultimately, I don't see why we shouldn't have higher staffing ratios to ensure the level of staffing appropriate to keep people safe.
Nate Krippus is an attorney with Utah's Disability Law Center. He says if staffing won't be improved at the federal level, he'd like to see the Utah legislature take it on. Utah currently only requires facilities to have sufficient staff to meet resident needs.
If there is a way to ensure better staffing ratios, I think we should. There's no reason why, we should have a lack of staff in a facility that is caring for a vulnerable population.
I'd like to see way more staffing.
Fonoti hopes that by speaking out, she can raise awareness of the importance of staffing and the consequences when there aren't enough nurses and certified nursing assistants on hand.
If this could possibly help any other family, help my patients, that transfer out of the hospital to these facilities, get better care and just hopefully just be a part of a change, a good change.
She says her mother's loss has been devastating, but in the end, it seems not even death has been able to fully keep mother and daughter apart.
On the way here, I kind of whispered as I was walking out here. I whispered, "Mom, be with me."
Do you feel like she was?
Yeah.
Whether it's now or later, a lot of people are going to end up here, and a lot of people are going to have parents or family members end up in these places.
As Utah's population ages, the systems meant to protect, support, and care for our older and disabled adults will grow increasingly important.
This is an industry in crisis.
I feel like these residents deserve better.
But a months-long Fox 13 investigation raises questions about how well these systems are serving those who need them.
It's in our best interest to improve the experience that residents have in these facilities because this is our future. Our state is aging.
I'm Fox 13 investigative reporter Taylor Stevens. Here are 5 takeaways from our reporting based on our review of 4,000 pages of federal inspection reports, dozens of police reports and lawsuits, and nearly 20 interviews with researchers, service providers, government officials, attorneys, and families and their loved ones who rely on this care.
If people aren't aware of it, nothing will ever change.
Takeaway number 1, Utah's government-owned nursing homes have received hundreds of millions of dollars through a program meant to improve care. But a recent state audit shows about half of that money, or about $450 million, wasn't spent at the nursing homes the funds were meant to help, as metrics raise concerns about their quality of care.
The money is being taken away from its intended purpose.
The audit says 51% of the money was used for a combination of owner compensation, administrative costs, and hospital operating expenses. The hospitals that own these nursing homes say they're in compliance with state and federal law, but advocates say that money could have made a big difference for residents.
We're seeing all of the problems, all of the injuries, all of the death that likely and probably would have prevented those injuries and those deaths if that money had been used.
Takeaway 2. About a third of Utah's nursing homes are understaffed, with below average or much below average federal staffing ratings. And experts say understaffing puts residents at higher risk of abuse and neglect. Utah currently requires only that facilities have sufficient staffing, a vague standard that can leave a lot of room for discretion. And some hope to see state legislators implement a minimum staffing standard statewide.
What would that look like? What impact would that have on facilities' ability to function? And what impact would that have on the quality of care and life of the residents? Those are all really good questions worth exploring.
Takeaway 3, sexual abuse is an underreported but unfortunate reality in long-term care facilities. We found federal regulators have cited Utah nursing homes at least 25 times since 2019 for failing to protect residents from sexual abuse. Because these allegations are commonly underreported, it's hard to know the true prevalence. But we saw some instances where perpetrators explicitly targeted older adults with cognitive deficits.
If you're seeing bruising, unexplained bruising, or injury to that person, particularly in the genital area or in the private areas of the person, that certainly should raise questions.
Experts say families need to be aware this is a possibility and say better staffing could help reduce or even prevent incidents of sexual abuse.
The more eyes that are available in a nursing home to monitor, to check in on residents, can ensure that residents are protected.
Takeaway 4. Hundreds of older adults, often with cognitive deficits, have wandered away from assisted living facilities and nursing homes. We found nearly 230 cases since 2019. Records show some sustained frostbite in the winter or suffered burns from falls on the pavement in the summer. At least one nursing home resident died after he fell into a body of water and drowned.
Too many families have lost loved ones with dementia to wandering.
Experts say this is another issue that can be addressed with improved staffing, as well as better training for staff and administrators.
If we can identify the more minor incidents, we can prevent the more serious ones and save lives.
Takeaway 5. Utah's Adult Protective Services investigators substantiate a far smaller percentage of claims of abuse, neglect, and exploitation than the national average. They uphold just 5% of cases, compared to 29% nationally.
That would raise red flags to me, extremely, that it's so much significantly less than the national level.
Some advocates worry that reflects low-quality investigations, as data shows some caseworkers were handling almost triple the recommended caseload in the first half of last year.
We're clearly missing something.
APS told us Utah has a high bar for substantiating cases, which may account for the lower substantiation rates, and says the agency is working with policymakers to reduce high caseloads.
We're certainly aware of that issue and are working with executive and legislative branch partners to make inroads on that.
The Fox 13 Investigates team will continue to look at Utah's elder care systems over the coming months. If there's a story you'd like us to look into, you can email us at iteam@fox13now.com. In the studio, Taylor Stevens, Fox 13 News, Utah.